Vitamin D, 25-hydroxy, includes fraction S, if performed. 1,25-dihydroxy, includes fraction S, if performed. Specimen is serum or plasma and method is HPLC, CPB, or RIA. Calcitonin. This test may be used to screen for specific malignant neoplasms. A fasting blood specimen should be taken. The specimen is collected in a chilled tube and the test performed within 10 minutes of collection. Serum, plasma, is separated in a refrigerated centrifuge and frozen. The test is performed by RIA. Calcium, total. This test may be abbreviated CA. Blood is obtained by venipuncture or heel stick. Method is AAS. The test may be used to assess thyroid and parathyroid function. Calcium, ionized. It may be abbreviated ICA, Ca++ or Ca+2. Ionized or free calcium refers to calcium that is not bound to proteins in the blood. It is the metabolically active portion of the calcium in the blood. Method is by ISE. The test may be used to assess thyroid and parathyroid function. Calcium, after calcium infusion test. The calcium infusion test is a provocative test for evaluation of medullary thyroid carcinoma, MTC. Calcium, urine quantitative, timed specimen. Calculus, qualitative analysis. Quantitative analysis, chemical. Infrared spectroscopy. X-ray diffraction. These tests may be requested as a stone analysis or nephrolithiasis analysis. The specimen should be rinsed to remove any tissue or blood. Chemical analysis generally includes testing for the presence of calcium, carbonate, cysteine, magnesium, oxalate, phosphates and urates. Carbohydrate deficient transferrin. Carbon dioxide, bicarbonate. Carboxyhemoglobin, quantitative. Carboxyhemoglobin, qualitative. Carcinoembryonic antigen, CEA. Carnitine, total and free, quantitative, each specimen. Carotene. Catecholamines, total urine. Catecholamines, blood. Catecholamines, fractionated. Chemiluminescent assay. Chloramphenicol. Catecholamines, total urine. Catecholamines, blood. Catecholamines, fractionated. Chemiluminescent assay. Chloramphenicol. Catecholamines, total urine. Catecholamines, blood. Catecholamines, fractionated. Chemiluminescent assay. Chloramphenicol. Cortisol, free. Cortisol, total. Creatine. Creatine is measured in urine or serum to evaluate certain conditions involving increased muscle tissue breakdown. It can be measured by colorimetric or enzymatic/spectrophotometric methods. Column chromatography includes mass spectrometry, if performed, non-drug analyte, S, not elsewhere specified, qualitative or quantitative, each specimen. Creatine kinase, CK, CPK, Total. This test may be requested as creatine kinase, CK, or creatine phosphokinase, CPK. Specimen is blood. Method is enzymatic, kinetic, or spectrophotometry. Creatine kinase, CK, CPK, isoenzymes. This test may be requested as creatine kinase, CK, isoenzymes or creatine phosphokinase, CPK, isoenzymes. Method is EP, column ion exchange chromatography. Creatine kinase, CK, CPK, MB fraction only. This test may be requested as creatine kinase, CK, MB fraction, creatine phosphokinase, CPK, MB fraction, or CK2. Methods include immunochemical, fluorometric radial partition, microparticle enzyme immunoassay, immunoenzymatric, or chemoluminometric. Creatine kinase, CK, CPK, isoforms. This test may be requested as CK isoforms or CPK isoforms. Specimen is blood. Methods include EP, HPLC, and IEF. Creatinine, blood. Test for evaluating renal function. Method is enzymatic or colorimetry. Creatinine, other source. Other source such as urine, amniotic fluid. Method is enzymatic, JAF reaction, or manual. Creatinine, clearance. This test may be requested as urea clearance or urea nitrogen clearance. Both blood and urine specimens are required. Method is enzymatic or JAF reaction, or alkaline picrate. Cryofibrinogen. Cryoglobulin, qualitative or semi-quantitative, e.g., cryocrit. Cyanide. Cyanocobalamin, vitamin B12. Cyanocobalamin, vitamin B12, unsaturated binding capacity. Cystatin C. Cysteine and homocysteine, urine, qualitative. Dehydroepiandrosterone, DHEA. Dehydroepiandrosterone sulfate, DHEAS. Desoxycorticosterone, 11. Deoxycortisol, 11. Dibutane number. This test may be requested as cholinesterase or pseudocholinesterase inhibition test. Method is enzymatic. Dihydrotestosterone, DHT. This test is used to monitor patients undergoing chemotherapy or 5-alpha reductase inhibitor therapy. Specimen is serum. Methodology is liquid chromatography. Dihydrotestosterone, DHT. This test is used to monitor patients undergoing chemotherapy or 5-alpha reductase inhibitor therapy. Specimen is serum. Methodology is liquid chromatography. Enzyme activity in blood cells, cultured cells, or tissue, not elsewhere specified, non-radioactive substrate, each specimen. Radioactive substrate, each specimen. Electrophoretic technique, not elsewhere specified. Electrophoresis is a test method that uses an electrical field to move particles toward electrical poles. It separates ionic substances based on differences in their rates of migration toward the poles. Some types of electrophoresis include disc, gel, isoenzyme, and thin layer. Erythropoietin. This test may be requested as EPO or SEPO. Erythropoietin is a hormone that regulates the production of erythrocytes, red blood cells. Method is RIA or chemoluminescent immunoassay. Estradiol, total. Estradiol, free, direct measurement, e.g., equilibrium dialysis. Estrogens, fractionated. Estrogens, total. This test may be requested as total estrogen in serum or urine. Method is spectroscopy or fluorometry. Estriol. Estrone. Ethylene glycol. Etiocholinolone.